Welcome, everybody. Welcome. Good evening, good night, good morning to welcome. We are back together again. For those of you who are returning, welcome back. For those of you, if this is your first session, welcome and thank you for being with us. I just want to quickly introduce myself as we're warming up to the session. My name is Dr. Kerriann Peart, and I am an associate with EarthMedic, EarthNurse, dealing with the portfolio of public health and psychology. So I work at the intersection of those two things. So welcome again, welcome all as we continue to file on in. It is so wonderful to see so many people. Hello, hello, hello. Please drop in the chat where you are signing in from or zooming in from so that we can welcome you accordingly. It is so wonderful to see. Let me pull up the chat and see where folks are coming in from. Bahamas, hello. Trinidad, Tobago, hello. Dominica, hello. Philippines, hello, Philippines. Hello, New York. Wow, my home of Jamaica. Hello, hello, Guyana. How are you, Guyana? So wonderful. Antigua, Barbuda, St. Lucia, Bangladesh. Oh my gosh, Belgium. Wow, 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 wow. We are worldwide. Hello, London. Hello, Puerto Rico. Welcome all of you. Hey, Barbados. I'm living in Barbados now, so my other home. Hello, Peru. Beautiful country. Hello, Haiti. Ah, wonderful, wonderful. Chicago. Went to school there. It is so fantastic to see you all. So again, welcome to our session for this evening. My name again is Dr. Kerriann Peart, and I'm an associate with EarthMedic, EarthNurse. It is so wonderful to be with you for this particular topic on climate change and mental health. It's something that's very important to me as both a public health practitioner as well as a psychologist. So it is fantastic to be here with you. So welcome all. I would like us to just do a little housekeeping stuff as we get further into our introductions and hopefully stay on time with our presentations and everything. So let's get into this. Tonight, we are happy to provide live interpretation for you, available both in English and Spanish. So if you go ahead and just open, excuse me, your Zoom panel, you will see kind of a globe icon that's circled here. If you click that, you will receive access to the interpretation that's happening live for your support and further access. So just open your Zoom panel and take a look for that globe icon. Click on it, and you should get right into the live interpretation access for your support throughout this session. So just want to make sure we're aware of that. So we are on our 7th session of our series on climate change and looking at all of the various ways it intersects with our global well-being. And tonight's session is on mental health, which I was mentioning is dear and close to my heart as a psychologist, as well as a public health practitioner that champions the behavioral sciences. So I'm excited for tonight's presentation. So for those of you who are coming in for the first time, welcome again. I want to highlight some of the objectives that folks who probably are returning are already aware of. But for tonight's mental health topic with climate change, we're looking at these 4 areas. And just quickly to highlight them, we want to focus tonight on discussing natural disasters that occur through climate change processes and their impact, their subsequent impact on the ways in which our psychology changes as the way we cope, I should say, to some of these stressors when it comes to natural disasters happening from climate change impact. We also want to explore the impact on mental health of climate refugees, those individuals who have to flee their countries because of the severe damages, I guess you can say, due to climate shifts in our global kind of communities. So looking at the displacement that occurs for those individuals, and again, how displacement impacts our psychology due to these shifts caused by climate change impacts. We're also going to look at how we describe what can be done to mitigate population mental health strain and the consequences of mental health due to climate change. And finally, this evening, our objective will also include exploring that unequal burden of climate change related to mental health disorders and discussing strategies to target vulnerable populations. So it's a lot. We're going to get through this as much as possible, and we continue to welcome you as you're joining and getting in through this session. Please remember that you can put your questions in the Q&A section of this webinar. So again, if you open your Zoom panel, you should see your microphone, your video option, participants, chat, and then you'll see those chat bubbles for Q&A. Click on that and upload your question for us, please. And please, please, please put those questions in that section so that we can record them, because we want to make sure that we keep our questions coming in and we answer them as best as possible closer to the end of our time together this evening. So we want to make sure we get your questions in. So please, please, please use that Q&A feature in your Zoom panel option. All right. We're recording this. So there's a video recording that's occurring right now, and we will have a link to show you for access later on for the slide decks and other materials that will be shared throughout our presentation. And if you forget any of this, put the question in the Q&A, and we will make sure we remind you that you will be gaining access to this recording and other slide materials at the end of our time together, and we'll give you that link. So remember, put your questions in that Q&A section for us, please. All right, moving on, we will be offering a certificate of participation for this session, of course, and participants that will be provided your certificate are those that attend greater or more than 70% of the live Zoom session today, and moving forward for other sessions. That's a standard. We need you to attend for more than 70% of the live session. And your certificate is also contingent upon you taking that final exam and passing with a score greater than 70% as well at the end of the course. And then you will be rendered your certificate of participation from us as EarthMedic EarthNurse and our GCCHE partners in crime, in climate change crime. So again, welcome. I saw a few more people signing in. Welcome. Thank you so much for joining us. And just to finally remind you that your attendance, in order for us to track that 70% of you being here for your attendance on Zoom, it's automatically recorded, right? So that's how we'll know if you actually stayed for more than 70% of our live session. All right. So let's roll on through. Also, along with your certificate of participation, you're also going to be awarded your CME credit. If you remember to click the Google link, which will be posted in the chat for you at the end of this session. So you will also be granted CME credits, one per session. At the end, you'll get a link to access for you to sign up for that CME credit. So please remember to look for that Google link that will be posted in the chat closer to the end of the session so that you can click that, answer a few questions, and record your attendance so that you can get your CME credit. And the link is live up until noon tomorrow. All right, noon Eastern time, I should reiterate that, noon Eastern time. Tomorrow, the link will stay open for your CME credits. So please remember to click that link at the end of our session today so that you can be awarded that piece. All right. So drum roll, do the drum roll in your head as we get ready for me to introduce our speakers this evening. I'm really excited about who we have here tonight. So first up, Dr. Peter Weller. Peter Weller is a born Jamaican, Trinidad and Tobago residing Caribbean man, husband, father, and clinical psychologist. He is a people watcher, problem solver, advocate, and educator by nature. And Dr. Weller is currently the co-coordinator of the MSc Clinical Medical Sciences program, psychology program and practicum in the Faculty of Medical Sciences at the Eric Williams Medical Sciences Complex at the University of the West Indies. And that's located campus in Trinidad and Tobago. He lectures there on topics of individual and group psychotherapy. Dr. Weller is also a member of the Caribbean Network for the Study of Masculinity and is co-founder and current president and chairperson of the Caribbean Male Action Network, otherwise known as Kerriann. You can learn more about this and we'll put the link in the chat as well. He currently serves on the Executive Steering Committee of the international entity Men Engage Alliance, an alliance of NGOs working together with men and boys to promote gender equality. And he also has been an advisor to the gender specialist at CARICOM. Welcome, Dr. Weller. Our other guest tonight is Josephine Williams. Josephine Williams is a registered nurse with 17 years of experience, certified emergency trained. She holds a master's degree in education, specializing in health promotion. She works as a clinical instructor at the University of the West Indies at the Five Island campus in Antigua and Barbuda. She is an associate member of EarthMedic and EarthNurse, and additionally, she leads the EarthMedic, EarthNurse, Antigua and Barbuda chapter. So welcome, Josephine. Welcome, Peter. It is so wonderful to have you guys. And I am going to turn over to our first presenter for tonight, Dr. Weller, and he will take it away.
There we go. Afternoon, everyone. I hope you're hearing me. And it's a pleasure to be with you. Congratulations, of course, to Columbia, EarthNurse, UWI, Pavo, CMI, everyone who has been involved in putting together this course. It's so critically important that all of us across the world begin to understand all the different ways in which there is hope for us in the ways that we look forward to changing our response to climate change, okay? So this is about a change process, and it's about how we look at things. Now, there's a challenge here. It's a little disconcerting because some of the things mentioned in my introduction are historical. I'm no longer lecturing and I'm no longer president of Kerriann, but I'm now actually also living in Jamaica. And very happy to be here, although virtually, to share in this forum. One of the challenges of this course is to try to compress so much information into a short time. And, you know, I'm a psychologist, I'm not psychic, so I can't get everything across in one small period of time. I've therefore selected some issues that I want to highlight. And you will realize that there's a lot more to climate change and mental health than we can cover in this 45 minutes. But hopefully some of the issues that I share will get you thinking and will get you researching and will get conversations going. Because this is really about us all working together across the world to ensure that our responses are synergistic and integrated and strategic. So having said that, let me see if I can share my screen here. And here we go. Can somebody let me know if you're seeing it? We had a problem earlier.
You're good to go, Dr. Weller. Yep.
All right, great, great. So I'm a consultant, community and clinical psychologist. I look at how people behave and how people engage with other people because of the way they behave. Today, we're going to be looking at trying to integrate the objectives that were summarized before. So from my perspective, this is really about care and influence. As health responders across the globe, you are in one way or another involved with taking care of people and influencing people, meaning influencing their thoughts, their feelings, their actions, and in fact, the ways in which they respond to their life experiences. So this forum is intended to try to increase your competency, to build capacity in many different areas, and also to create community interventions based on your change process that you are able to, well, you're not going to create the community change process, but you're going to contribute to the community change processes. These are all in the context of global changing patterns of climate and the ways in which people behave. So I'm adding a psychological perspective, read the impact and the vulnerabilities and mitigation. And I'm going to mix it up a bit in terms of the original objectives, but I'm going to try and make some important points as we go along. You'll see at the top of your screen two phrases. On the left, inward reach, and on the right, outward stretch. And it's a concept that I think is very important as we look at how we deal with life's changes and life's challenges. It's about the inward reach of understanding yourself, understanding factors that influence you, understanding your mindsets, and then doing an outward reach, which is understanding the people who you are going to take care of, who you're going to influence, and ensuring that you understand where they're coming from and what they need. And I think the concept is really important because if you don't do the inward reach, then you're going to lose balance when you do the outward stretch. And that is not good for care. It's not good for care for others, and it's not good for care for self. So I want you to look at this today as ways in which perhaps you can increase your understandings, both in terms of that outward reach, but also in terms of that outward stretch, but also in terms of that inward reach. Obviously, climate change affects mental health. And in the past, there was a lot of inattention. When I first started doing this presentation, this slide highlighted in previous years how little attention was paid to the psychological impacts. As you can see, the frequency of psychological related impacts is probably sometimes far greater than the physical, even though the physical is very significant. Things are changing, of course, and as we've seen from the COP conferences and we see from our regional conferences, these linkages are now being examined and addressed. I have to commend here one of your colleagues in the program, and Andrea Gaines Mohes, who has done a very good presentation she used in the Caribbean, and I'm hoping that she'll be willing to share it with you all, giving a lot more detail on the psychological impact and the need for involvement of psychologists in our response to climate change. I'm not going into those issues here, but I do think that those are critical issues that need further examination across the globe, not only in the Caribbean. So, mental health. Here's my take on mental health. Too often we look at mental health as a pathology, the illnesses, the diagnoses, and we forget that mental is really about relating to the mind or involving the process of thinking. So I tried to summarize some of the key issues I wanted to be considering here in these slides. Some of you may have seen some of these before, but I'm going to do a little twist or a different take on them perhaps. To the top left, and I'm going to zoom in a bit, there's an image that I want you to look at carefully. What do you see? And as soon as you see, write what you see in the chat, okay? Let's get your input on what is this a picture of? All right, I'm gonna move quickly because it's only 45 minutes and several are gone already. In the second image, share when you see a word. Now, if you're not English speaking, you may not see the word, but look carefully at that image and see what it is that you do see. And again, put it in the chat. Not giving you a lot of time for this. Let's just see what comes automatically. And finally, what is this an image of? What is this an image of? Now, I can't see what's coming into the chat, but I hope we're getting some comments from folks across the world.
Yes, you are, Dr. Weller.
Great, great.
First image, they said old woman, young lady. The second image, they're saying a face or the word lion or liar. And then the other one, they're saying two faces, face of a man. Yep.
Yes, and that last one has a man looking forward and looking sideways. Now, one of the things that I think is important about these particular graphics is that they remind us that how we look at things is influenced by where we're coming from, and then how we look at things influences the choices we make. That first image, some people automatically see an old woman, some people automatically see a young person, a young woman. It reminds us that as we try to influence folks' response to climate change and prevent ill health, we have to help them understand what is going on and also understand that what they see may be different depending on age and stage and culture. The same holds true for the second, which, for some people, they only see a face and they don't get that message about being a liar, which has a lot of emotional component to it. And this might be a function of your culture, it might be a function of your personality. The point is, when you're seeing something differently from the way somebody else is seeing it, you may not be able to connect with them and understand what they need. So those first two images are kind of highlighting why we need to take that psychological perspective as we look at climate change and its impact. Not get lost so much in whether it's a hurricane or an earthquake or whatever, but rather look at the feelings and the perspectives and the mindsets that are involved, and what we need to do to shift those so that they are more likely to promote well-being. The last slide on the top right really is a reminder that you can see the same thing different ways. That man's face is looking in one direction and in another. In other words, things coexist. And one of the big challenges that faces us as we look at climate change is the fact that you can feel hopeless and helpless and still feel active and trying to be involved. You can feel happy when something good happens and sad and depressed as well. All of these feelings and thoughts and emotions coexist at the same time. And unfortunately, because of that, and because of the way the mind functions, we tend to try to compartmentalize and focus on only one. It leads to stress, it leads to frustration, because it's all going on around us. And nowhere is that more clear than when we work as responders, where we're seeing all the worst that's happening in climate change, but we're also seeing the best of people. And it can get very stressful, not being sure what to focus on. But the reality is we have to learn to accept that it's all real. And that process of thinking takes effort and energy, but it leads to that stability that I mentioned in terms of that inward reach and outward stretch. Now, let's move to the lower three slides, and pretty self-evident. It reminds us that we all have different perspectives, but more importantly, we have to understand that when somebody else has a perspective, it may be we're just not seeing it from their side, or it may be that they don't understand and they need to come around to our side to see what it really is. The point is, unfortunately, too often this leads to conflict. And I don't necessarily mean conflict as in war and rebellion and violence. I mean conflicting views. And unfortunately, when those views conflict at the level of responders and those involved with policies and programs, it's more than a trickle-down effect. It's a cascading effect that is not constructive. We have to understand, therefore, how different people are seeing climate change, why they see it that way, and what needs to happen in order for us to get aligned and engage in a worldwide approach to managing climate change. And in this context, mental health. Because, as the next slide shows, and this is a phrase that was attributed to John F. Kennedy, but in fact, it's really not. It's an old Chinese proverb that was used by him for political reasons, but the message is important. One of the shifts that we have to facilitate, especially in terms of helping people to stay engaged with hope, stay engaged with a sense of efficacy, is that we have to help understand that danger and opportunity coexist. Back to the image of the man looking forward and looking to the side. It's really critical that we help people to understand that, yes, things are very bad. Climate change is an increasing problem. The effects are going to be felt more greatly, but we also have more people becoming involved, more technology being used. We need more political will, and there's an opportunity to make a difference. We have to keep pushing that if we're going to promote that balance, that inward reach, that outward stretch, and of course, well-being and mental health. And then the final image on this page, and I'm again summarizing, reminds us that for many reasons, many of us don't see nature as something that we are a part of. We see ourselves as central, with everything in nature peripheral, and we used to think it was under our control. You could flip that one on the left and see it as a pyramid with, many people looking at the environment and the world as men and women and children on top, and then animals, and then plants, and then the rest of nature. The truth is, we have to shift that mindset, and many of us don't read the signs, and therefore as responders, we have to really send that message that when we don't see ourselves as part of the system goes off balance. The only thing positive about seeing yourself as a center is that you can think that you have a role to play. But that's somewhere you go, and I'm going to repeat this. The ego image is a space you go to look around and see what is happening, to figure out what needs to be done, but you always put yourself back in the circle. You cannot stay outside that circle because that is not constructive and it's not reality. We have to be part of that balancing act. So I'm summarizing some of the key concepts that we're going to be looking at through this. And the main issue here is that you as responders are influencers. Now, it's a term that's used a lot in the contemporary communication and social media, which really looks very often at branding and marketing and selling products. But in fact, in this context, you really are influential. You're influential, and it is about learning how to use that influence to mitigate against the negative effects of climate change. Today, we're talking about specifically mental health. Your influence is going to be felt both in terms of the quality of care provided in the health systems. It's going to be felt also in terms of the mindsets and cultural shifts that need to take place when we look at promoting awareness and knowledge. Having said that, therefore, let's jump in a bit to, let's get that next slide. The Caribbean context. Now, you've been hearing a lot in the other courses, and you'll be hearing in future courses. For example, on Thursday, you're going to hear about the health systems and building resilience. What I want to talk a little bit about is the Caribbean as a vulnerable area, because it's said to be the second most disaster-prone region in the world. Now, I'm not going to spend a lot of time on disasters because you're hearing about all of them in the other fora. What I do want to speak about is how we look at disasters. And just remind, because it's been mentioned before and will be mentioned again, that we can look at these climate change and disasters as acute. And I was misspeaking when I said generalized disasters, but you have the acute disaster type events, which are the floods and the hurricanes, etc. And you have the subacute, which are those which are not functioning in such a disastrous effect immediately, but certainly have a significant effect, such as droughts and heat waves. Then you have the chronic ones, which are the ones that are going on continuously and perhaps are not something that we perceive easily, such as the sea levels rising and desertification, etc. But those are having significant effects on us as individuals and on the society. It certainly affects our mindsets. And sometimes the chronic effects are more deleterious because we don't realize that it's a building tension. With an acute and even a subacute event, our mind goes into either fight or flight or fear, whatever it is. We go into action and we do something. The problem with chronic climate change is that either we're not paying attention because we're not seeing the change, or we are on all the time. We are always tense. Every time we walk and look around, we see something that reminds us. And of course, physiologically, our sympathetic and parasympathetic systems go out of whack. So this all leads to those mental and psychosocial consequences that we are calling mental ill health, but in fact really are more psychosocial, because it's not just about the pathology of the mind and the diagnoses. So as we think about mental health, and as we think about our role as responders, we need to think about the needs that result from acute events and subacute events, as well as the more chronic and dynamic processes. And as I say at the bottom there, it's not a stretch to understand that when an acute event occurs in a chronic context, the psychological and psychosocial effects are even more dramatic. When you have a volcano erupting in a country that had to deal with hurricanes before, etc., and you know that hurricanes are coming again, you always have that anticipatory anxiety. So the mental health challenges are there, they're complex, and we need to understand and use the ways. There are many ways available, and we'll talk about some of them that we can use to respond. My colleague Josephine is going to talk later about the details of the effect in Antigua and Barbuda. And he's going to break down some of the psychological dynamics and the responses, etc. I just wanted to highlight a few images here. One is from the Bahamas, and I think my colleague Ava may be on this call as well, on this program. New onset hurricane-related psychopathology was found to be prevalent, including distress and sleep disorders after the hurricanes that hit the Bahamas in the late 20s. Patients began to describe ongoing distress related to loss, to role transitions and life changes, including unemployment and displacement. And they began to have a very negative view of the future. So here's an acute event that had very direct and also chronic effects on the society that required particular interventions. And I know when Josephine speaks, you'll hear about a lot of interventions that took place in Antigua, Barbuda, because they're very similar to what happened in the Bahamas. But going outside of our lived Caribbean experience, we know about the impact of droughts on mental health. And I just want to highlight two of the issues that, sometimes get lost. Yes, you know about drought and the lack of water, etc., and even on the effect on agriculture and those vulnerable because of their occupation. But sometimes we forget that because of the scarcity and drought, can lead to conflict that then can have violence involved, and in fact has led to migration, etc. So you have these multiplier effects that we have to be aware of and factor in when we're designing interventions. One of the things that sometimes people don't realize or remember is that issue of medications. And I'm using here the example of antipsychotic medications that when people get dehydrated, don't work as well. The effects on the elderly, etc., and those who are dependent on medications are also affected. So, that needs to be part of our public education campaign, but it also needs to be part of the work that we're doing to build self-awareness among those who might be particularly vulnerable. We're going to hear more about storms and floods later, but I'm just highlighting here. Obviously, I think we all know that there's the mood effect, and there's going to be depression, sadness, etc. There's going to be reduced cognitive functioning, partly because of the depression, partly because of the confusion and the overwhelming nature of the destruction caused by some of these acute events. You're going to have anxiety, irritability, and fatigue. And in fact, research shows that aggression increases and violent behavior increases as the heat increases, but also in terms of responses to the destruction from storms, etc. I highlight here in the picture and on the slide something that, again, it can get lost in the shuffle, which is that, after the storm and the flooding is gone, you're left with certain challenges and types of destruction, such as mold in buildings, that can trigger all kinds of allergic reactions that can lead to their own emotional and medical problems that people have to be prepared for and have to learn to deal with. And as responders, it's part of our educational process and part of our care process to kind of not overwhelm people with all of these issues, but to be aware of them ourselves so that we can be prepared to respond appropriately. The negative behaviors that result. So a lot of research is showing that substance abuse increases because people have to cope with the stress and anxiety caused by the destruction of either acute events or chronic situations resulting from climate change. So you have an increase, for example, in alcohol and other substance use and abuse. And that increase may not be to the level of pathology of people feeling, for example, being drunk and not being able to work. But that substance use may border abuse in that it becomes a coping mechanism that inhibits other coping, healthier coping, and affects relationships. So you end up, of course, with more aggression related to substance use and abuse. And of course, you end up in more violent crime because as the climate change affects the economy and there's social dislocation, you're going to have more conflict. You're going to have more personal and internal conflict, evidenced by the suicides attempted and completed, and research is showing that that does increase. And going back to the relationship dynamics, you're going to have more gender-based violence. Of course, that itself can then lead and trigger post-traumatic stress disorders, adjustment disorders, and depression. So there are a lot of negative behaviors, none of which would be very surprising to any of us. But what we need to keep track of is how much of this is occurring in what populations and who needs the appropriate interventions. We can't wait for it to become a problem. I think we need to have, as part of our toolkit, strategies for addressing all of these areas. And these need to be part, for example, of our professional training or curricula, etc., to ensure that we are prepared for what we know is to come. Climate refugees and those who are displaced get a lot of attention in the media, understandably, because it's happening all over the world. And the displacement not only affects those who have lost their familiar homes, etc., it affects those who welcome them to one extent or another into their new environments. In the Caribbean, of course, we've had a number of different instances here. I highlight Bahamas and Haiti and the earthquake and the hurricanes and the mental health issues that have been identified in the displaced communities, but also in the receiving communities and societies where there's cultural conflict and competition for scarce resources. Across the world, we have the issues of the children affected by bushfires in Australia who have sleep problems and panic attacks. We have India and Bangladesh and other countries, of course, that have the floods that lead to PTSD and depression and anxiety when the populations are displaced. In Guatemala, the hurricanes, not only Guatemala, but this is just one example, led to a lot of forced migration. In Kenya, the droughts and desertification uproots families. In Germany, you have internal displacement and then the effect of the entry of refugees and migrants into the system. So climate change-induced displacement has multiple impacts across the world. The effects are not particularly unique. And I think one of the points I'm trying to make here is that what you see are very predictable emotional responses of anxiety, of depression, of helplessness and hopelessness that then lead to behaviors that are quite often unhealthy, such as substance abuse, aggression, violence, etc. It is for us to understand how these behaviors require different interventions based on the cultural context in which they're occurring. The cultures of those who are being displaced and the cultures that they are being displaced to are very important factors that need to be unpacked and examined because the cultures are changing. And you'll find in countries where you have the arrival of refugees, you're going to have changes in the home culture as well, sometimes positive as synergies and similarities become conscious, but unfortunately sometimes negative. And part of our response to the global impact of climate change on mental health is to begin to understand more about how this operates in our own locations, in our own countries and regions. And we talk about vulnerable groups, and very often we talk about the needs of the indigenous, of the elderly, those in low income, children and youth, those whose occupations are affected, whether it's fisher folks or farmers, people living with disabilities. We've touched on the migrants and refugees, and of course, other marginalized people. Now, the thing about vulnerable groups that I like to emphasize here is not as much about the unique individual needs. It's the fact that that term vulnerable groups is a little dangerous because it's putting people into categories that don't necessarily fit for them. Somebody who is elderly, maybe indigenous and low income and a migrant. A child may have a disability and be marginalized, etc. So we have to be very careful because even as much as we have to target our interventions, whether it's targeted at the individual or the different levels of society, we always have to remember that people are unique and that their needs require our attention if we are going to engage with their minds and going to help them make choices that are healthier and cope with the stressors. So we have to understand the culture and ethnicity issues. We have to understand the gender and identity issues and not get caught up in targeting based on one dimension of somebody's identity. As I said, the indigenous communities may have issues around cultural disruption and trauma. The low-income urban residents, few resources, pollution, heat waves, inability to escape to a cooler, cleaner, more environmentally friendly space. Rural farmers will have to deal with crop failures and water scarcity. And in fact, in some countries, this has even led to suicide and self-harm. It's particularly important to keep in mind that because of the gender dynamics, those affected as men may be different from the effect on women. So we need to target our interventions. And we can go down the list in terms of the trauma of uncertainty, the impact of heat stress and limited mobility, difficulty accessing resources, etc. Again, I could take the whole time to just talk about vulnerable populations and what we have understood about them. But one of the takeaways is that there's a lot they have in common, and we need to be able to provide those kinds of services. At the same time, there's a lot that makes them unique, and we need to understand how to fine-tune our toolkits so that they're most viable and effective as we work with the various different populations. They bear an unequal burden, and we have to keep in mind that uncertainty, all the stressors that they face, obviously are going to affect their mental health. The social challenges, especially when there are loss of resources, dislocation, etc. But one of the biggest challenges they face is limited government support. And those of us who work in state systems and in NGO and advocacy groups have our work cut out to try to improve and increase services made available to those who are feeling the effects of climate change, particularly those whose mental health and well-being is being challenged because they are less likely to be able to perhaps access services and are going to be less productive in society based on what has been determined as productivity by the state. Summarizing, therefore, cultural sensitivity and intersectionality is important. We have to not only understand the cultures, but we have to also understand the intersections of the different identities and variables that help define people. Increase access and affordability, and one that I could spend the entire session talking about, promote self-care strategies and skills. One of the projects that has been ongoing in the Caribbean over the last couple of years is work with the UN Women to develop a self-care toolkit that would help to promote strategies and skills for self-care across the region and across time using a lifetime developmental approach. I could say a lot about this, but I think it's important to realize that when a climate crisis, an acute disaster occurs, that's not the time to try to teach people about mindfulness and deep breathing and conflict management. Those life skills have got to be something that we as health responders, healthcare providers are engaged in promoting across the board all the time. And then we are able to then pull on those when there's a crisis or a disaster, because trauma-informed interventions have got to be part of our toolkit. But you are more likely to do effective trauma-informed interventions if the persons you are working with already have a mindset that appreciates self-care and has some of those tools and strategies already in place. Then they're more likely to benefit from the trauma-informed interventions. So let's move to who we are. And here's the big challenge. As we think about the future of climate change impacts on mental health, everybody wants to change. Everybody wants things to change, but who wants to change themselves? No hands in the air. And who wants to lead the change? That's even worse. Everybody's gone out of the room. Now, you are in this room, you're in this virtual space, and hopefully it is because you want to see change, you want to change yourself, you've come to get information, etc. Now the question is, do you want to lead change? And unfortunately for many of us, leading change, we've had a bad experience with it. People are very resistant. Systems are rigid. There's just too much in the way, including our own personal lives that we have to deal with, our own challenges. But I'd like to share with you some concepts, series, tips that I think might be helpful as you hopefully move forward to take this beyond just increasing your own personal knowledge, but finding ways to communicate it, to be an influencer wherever you might be. So let's just go through these. Now we know the model of prevention, preparedness, response, and recovery. And MHPSS is talking about mental health and psychosocial support. It's very important that we understand that this type of intervention is necessary at all stages in terms of the disaster response. In fact, in terms of life, we always have to be mitigating, doing prevention. We have to help people prepare, we have to help them respond, and we have to help them recover. And a lot of our mental health and psychological interventions really fit within those categories. But the key point to remember here is that it's not sequential, it's always ongoing. You're always doing prevention, you're always doing preparedness, you're always doing response, because there's always something to respond to, and there's always going to be recovery going on. We think of it very often as mitigation. And when it comes to mental health, mitigation is about trying to manage the impact by alleviating anxiety and stress, etc. And rehabilitation is more about addressing the trauma and fostering resilience in the affected populations, moving beyond the acute and immediate need. And recovery is really about long-term psychological adaptation. Now, I want to just make a quick point here because there's not a lot of time to go in detail. But in the region, in the Caribbean, one of the challenges we have is that we don't get enough support for interventions at each of this level. So we are very grateful that organizations like CDEMA, the regional disaster group, that PAHO has worked with them and other agencies, that the psychologists in CANPA, which is the Caribbean Alliance of National Psychological Associations, have been partnering to identify how we can ensure that a psychological perspective informs interventions at all these areas. And just a little plug to say that it's really important that all of us who are responders, and many of us are involved with organizations like the Red Cross, etc., where we go in when there are acute and disaster events, we need to understand the importance of that cultural sensitivity, and also the importance of trying to build sustainable systems. So going in and doing a hit and run, crisis intervention that doesn't match the culture and doesn't increase capacity of local people is something that is a big problem for us in the region. I'm sure elsewhere in the world. And it's something that we have to advocate for if we're going to scale up our own resources and our own competencies. So I'm moving along quickly, but I think—
Dr. Weller, sorry,
yes,
I just want to give you, we're at the 10-minute mark.
10 minutes left, right?
Yes, correct.
Yeah. So now I'm going to have to go on turbo. At the very beginning, I mentioned to Dr. Hospitalis the importance of hope, something that he knows already. But as responders, we have got to instill hope. Hope is critical and it has to be embedded in culture. A lot of cultural factors and beliefs can either help or hinder the hope that we can have ourselves as responders, that we can make a difference, but the hope that people can have that makes it worthwhile trying when faced with all the negative media about climate change. So understanding the culture, understanding what coping mechanisms are in place and how they can help and hinder, understanding what help-seeking behaviors mean are going to be very important. It's all very well to tell a man that he should go for counseling, but in that culture, if counseling is seen as something that a man doesn't do, then you have to find a way to communicate that more efficiently. Maybe you call telling him to go to a workshop. Maybe you're saying there's a stress management thing or something about being a better father to your children in hard time. Whatever it is that gets him into that place. We have to understand the culture so that we make sure that what the beliefs that people have are facilitating a healthy response and not hindering. We have to help people understand that that inward reach and outward stretch is not just about physical health or getting supplies to people in a time of crisis. It's about maintaining a sense of balance in all aspects of wellness. So this is a mindset that we have to have and that we have to promote. Environmental wellness, financial wellness, emotional wellness, occupational wellness, social wellness, physical wellness, intellectual wellness, and spiritual. There's a lot of literature now about how these domains of wellness can be facilitated by mindful interventions. There are a lot of resources online that we can use and that we can help people use as we try to help them to maintain that balance of wellness. But all of this means that we really have to understand behavior change. We have to understand that this is not just about throwing information at people. Knowledge alone doesn't change behavior. Teaching somebody a skill alone doesn't change the behavior. We have to understand that if we're going to change behavior, and by behavior I mean self-care, wellness, managing the mind, then we have to target our interventions. We have to know what we're trying to change, how we're trying to change it, who are the people involved. We have to teach people to think with the heart, manage both what's going on in their mind and their thoughts and their feelings so that they can overcome the barriers that might get in the way. And there are ways we can do it. Hope and optimism always helps. And the research is showing that a key part of what we're doing is to try to promote hope. And I've said that before, I'll say it again. It's about acceptance and redefinition of hope. And I just want to highlight the first one here. Redefinition of hope as a frame of mind and heart rather than a prediction about the future. Hope is an attitude, a can-do, I'll make it work, I'll keep trying attitude, rather than just looking at the future and seeing doom and gloom and giving up before you even take that first step. We want to be able to help people to encourage. We want to encourage people to expand how they look at things, and this will strengthen their climate resilience. You know, we're doing a big battle against what the media is sharing in terms of the negativity. And we have to help people take those steps, those one-by-one baby steps towards taking care of themselves. And hope is there, and we need to remind ourselves, even as providers, that as we talk about all the negativity of the different diagnoses of eco-anxiety and grief and so on, we have to remember that some of these are normal reactions and they can have a positive effect. Eco-anxiety can motivate individuals to take action. If you didn't feel anxious, you wouldn't do anything. Climate grief, you know, can foster empathy and solidarity. If you're feeling grief and you understand how somebody else feels it, then you can connect and you can help. Even climate despair can prompt advocacy for systemic changes and policy reforms. So I really want us to shift our mind from seeing the pathology and the negativity of emotions and look how these emotions can be harnessed, both for ourselves as we try to stay involved, but also for the people that we're working with. So lots of different theories around that can help you. Cognitive behavioral theory helps people change and challenge any maladaptive thoughts and patterns. This is not for therapy. This is not for science. heavy research. This is for what you do when you're working with somebody. When you understand how they think and you show them a different way of thinking. It may be in your office, it may be in a presentation. Stages of change reminds us that not everybody is at the same level of readiness. Some people haven't even thought about the environment and climate. So they need one set of information for them to say, oh yeah, this is something I'm concerned about. Moving along, they would see that, okay, there are things I can do, there are things I can try, and you want to move them through the stages of change. You know, understanding what is desirable and what is in their control is important. And the socio-ecological model, which I mentioned earlier, is something else we should have as our mindset to say, if I'm going to do something, who am I going to be targeting? Is it individuals? Is it a community? Is it institutions? Who needs what messages about climate change and mental health? How can I build community at different levels of society? So cognitive behavioral theory is about how we change our core beliefs and our automatic thoughts. So instead of having people say climate change, oh, there's nothing I can do, it's going to get bad, worse, and terrible. You want to change it to, okay, it is going to get bad and worse, but it doesn't have to be that bad, and I can make changes where I am, and it will make a difference, and I should do it. We want that to be the automatic thought. We want to understand these stages of change, as I mentioned. So pre-contemplation, you're not thinking about it. Contemplation, you kind of have an idea where you want to go. Preparation, you're getting ready. Action, you're doing it. Maintenance, it's a new habit. When we apply this to mental health interventions, it's important to keep in mind that it applies both to us as providers and the work we do. And it's a mindset shift that helps us to target and be more effective with the people we're working with. Here we have the image that reflects the socio-ecological model. What we're doing in mental health can be at the individual level, it can be at the interpersonal level with family and friends, it can be at the institutional, the community, or the policy level. So as responders, we can play roles in any of these areas. Our influence can apply in any of them as we raise awareness and increase strategies and skills. So individual level, interpersonal, community, and societal. Our mental health and psychosocial interventions also can be at all these different levels. So we can deal with the basic needs people have, but we can strengthen community, we can provide psychosocial support, and in the cases where the dysfunction is so high, we provide those clinical services. But these are all going all the time. Psychological first aid is another critical concept and skill set that I think we need to have, in which we understand that we need to mitigate against the mental health impacts. The core principles are we need to be clear what we are seeing, give practical advice, assess, and meet those needs. We need to look at what's going on, but we need to listen also, and this gets back to us understanding what is going on with people and what they need. And then we need to link. I think this is so important because for many of us as health responders, we either go too far and try to do everything, or we think, I can't do anything. But if we think about it as look, see what's happening, listen, find out what is going on and what it means, link, connect to the services, then we're able to set boundaries. We're able to take care of ourselves as responders, but still feel that we're doing something to help people. At the basis of all of this is that we're trying to influence knowledge. The more you understand what's happening and awareness, the more you're in touch with what is affecting you, then you have more insight and you appreciate why these things affect you. And then you can use your skills effectively to make new habits. Too often as healthcare providers, especially when we are dealing with mental health, we go in and teach skills. But the skills are not used because people don't have the knowledge and awareness and the insight. And we haven't helped them to situate these skills in a way that it can become a habit. So think about CAISO. As Caribbean people will understand the significance of that as a way of looking at, if you're doing an intervention, how are you influencing knowledge? How are you raising awareness? How are you increasing insight? How are you teaching skills and creating new habits? And now I'm moving really fast because it's a reminder that there's a lot of technology. We talk about AI a lot, but there's a lot of technology out there that can help to identify and predict climate-related mental health risks. So the technology exists already, And then there's a technology that can be helpful for people, where when you use your look, your listen, and link, you can link them to virtual resources if they have the technology, or to people who have those virtual resources. And you can use them yourself. At point number 4, there are self-care resources for first responders and healthcare providers that help you take care of your mental health. Putting on your mask first is critical. All that we've talked about are mindsets, concepts, and skill sets that you can develop, but you won't do them effectively if you're not taking care of yourself. You can't pour from an empty jug. So, stress affects you as providers. There's burnout, there's helplessness, emotional exhaustion. And so you have to prioritize your self-care. You have to set your boundaries, and you have to engage in activities that are going to make you feel better, make time for it. All of these things, if you practice them as self-care, you'll be better able to promote them as other care to other people. If you bought it yourself, you're much more likely to sell it. So here's what we want to create. Change agents. We want you as influencers to use the positions that you're in. You may be a vet, a lab technician, a psychiatrist, you could be a nurse, you could have specialties. You are in a community of others in your position, but you're also in a community of people who are interested in climate change and mental health. You're in a community perhaps of people who actually practice it, who actually work with climate change and mental health. Or you may be in a community of purpose where the entity you're involved in shares a purpose of climate change and mental health as its core principle. Wherever you find yourself, you can be that change agent. You can be that influencer that allows your knowledge and skill set to enhance what we're trying to do to mitigate the effects of climate change on mental health and well-being. So in closing, a reminder, we need to reframe. It's not about ego, it's about nature. The eyes are useless when the mind is blind. If we don't open our mind to other perceptions and perspectives and ways of looking at things, then all we see will make no difference. Bottom left-hand side, a reminder, culture, culture, culture. Culture is a space in which people operate. Culture are all those unexamined beliefs that help them that keep them stuck in patterns. Anything we're doing has to be contextualized. And finally, hope. Hope and humor. This last image, if you can see it here, have you ever thought of this? In reality, plants are actually farming us by giving us oxygen daily until we all eventually decompose so they can consume us. The reality is that we're all part of nature. Whether we're the ones farming the plants to feed us or they're the ones farming us, we need each other. There's no way about it, and our mental health requires that we understand that. Some resources for you to look at, and thank you, gracias, merci beaucoup, big up, and over to Josephine. Thanks for your attention.
Thank you so much, Dr. Weller. That was extremely exciting for me because that mixes both of my public health passions as well as my psychology revelry that I love. So thank you so much for that presentation. I am going to switch gears quickly so that we can have Josephine go ahead and present for our case study piece. And hopefully we'll have some time to answer some of these questions because these questions are amazing. So looking forward to that. Miss Josephine, over to you.
Hello, everyone. It's great to be here. Dr. Weller has spoke a lot about the impact of climate change on mental health, and I'm just going to add a few more to this. We would have spoke about the objectives at the start, so we're not going to go through all of these again. Now we're looking at the impact of climate change on mental health. Dr. Weller spoke about acute and chronic when we talk about the events of hurricanes and all these other climate changes. However, We also going to be talking about the acute and chronic changes that you're going to see when you're looking at mental health. Now, these impact can be either acute, meaning they're just short-lived, or they can be chronic, meaning they last a very long time. So depending on how long they last, they can either be acute or they can be severe. These impacts can manifest as either aggressive behavior, they can be violence towards others. There's also grief, anxiety, and there are just a whole host of things that can happen to this person or to other persons who have been experiencing these events. People who are living in the low and middle income countries are those vulnerable ones who are most at risk. And this is because they are more prone to extreme weather events, and there's a lack of access to services and high levels of poverty. Now, Antigua and Barbuda are twin islands in the Eastern Caribbean Sea, and they're located at the southern end of the Leeward Islands. Barbuda, which is formerly known as Dulcina, is 40 kilometers north of Antigua. The people in Barbuda are known for their fishing and also for their agriculture. In 2017, Barbuda was destroyed by Hurricane Irma. So we're going to touch on how those people were affected by Hurricane Irma in 2017. When Hurricane Irma passed, it would have hit several countries. This includes St. Martin, Anguilla, St. Kitts, Nevis, Dominica, Bahamas, British Virgin Islands, Haiti, Cuba, Dominican Republic. However, Barbuda got most of this. This hurricane had changed from a category 3 escalating to a category 5, and this would have caught a lot of people off guard. Now, in Barbuda, there was more than 80% of destruction to the property and to residents there. As I said, because of this drastic change of the hurricane moving from a category 5, from a category 3, sorry, to a category 5, this would have caught persons off guard. And I don't think from what we have heard and what we have seen that persons were prepared for this. So during a hurricane, you can find persons can become very overwhelming. They're going to experience lots of emotions. They're going to be shocked. They're going to be having fear. They're going to be seeing all this devastation. They're going to be worrying about their family and their friends, if they are safe. They're going to be wanting to help others. Now, a team of us, comprising of myself and my colleagues, we decided that we wanted to go and investigate how the people in Barbuda are doing 6 years after Hurricane Irma. So we were looking at the psychological impact. They shared their story, and this is a story that one of the person would have shared with us. All of us stood inside, seeing the roof jumping up and down until it eventually ripped off. The force of the wind pushed everyone on the ground. That was the time we were most shocked, but still saying we must go out to save people. When it was calm as the eye passed over, we went out hearing people screaming for help and loud cries. It was there my thoughts went to my daughter. We didn't know where to start, and we believe we had a lot of dead bodies just by looking and seeing what we were seeing. Now, during Hurricane Irma's fury, first responders would have bravely gone out when things were calm to go and assist with transporting persons to the shelters. They would have been hearing their heartbreaking cries, seeing the devastation firsthand. When they have transported persons to the shelters, they would have to move them from the shelters as well and take them to the hospital because the shelters were leaking. And just doing that, the hospitals became overcrowded. Now, they too themselves were worried about the safety of their family. While they were there, they then heard of one baby who had lost their life during the hurricane. After the wind picked up again, we had to stay at the hospital. At the hospital, it was worse. Seeing everyone, people crying, and it was emotional for me not knowing if any more lives were lost, and then know it in the morning, we, as in the first responders, have to go out and retrieve dead bodies. We were at the hospital until the storm completely passed. The hurricane lasted for several hours, and it left a trail of destruction in its path. In the morning, when the first responders went out, they wasted no time. They started clearing the roads, checking on persons to see how they were doing, looking to see who were affected by this disaster. As again, they saw this devastation of homes, of buildings. They have to be going through flood waters, and not just them, but everybody else who were there, and just trying to help and providing first aid for those who were there, because that was their main priority. Other person would have been going out to check on their property to see what damages were there and helping others as well. The effects of climate change include the disruption of communities. This displacement of people from one place to the next and the breakdown of social support networks. So this is when you start to have social disruption and isolation. And these things can occur because of these events. Once you have these events and a person have to be shifted because they need to be safe, you're gonna have social disruption and isolation. So in 2017, following Hurricane Irma, a decision was made to evacuate the residents of Barbuda to Antigua. This was in light of Hurricane Maria, which was approaching the island. So even after Hurricane Irma had passed, there was another hurricane that was looming, and they didn't want to take the risk of having persons there and with all the destruction. So they need to make sure that the persons of Barbuda was safe. The widespread destruction and flooding exceeded more than 80%, and this needed urgent action. So this is when the Prime Minister made a decision that they're going to evacuate everyone from Barbuda. Families were also forced to leave their homes and belongings, and in some cases, they were separated. Our interview captured harrowing accounts of the evacuation ordeal, and this is what persons had to say. It was hard seeing my home destroyed. The hardest part was having to leave everything behind. I woke up with a light shining in my eyes and someone telling me I had to go. I was confused, not understanding why I had to leave since my house was not damaged. I woke up with a gun in my face, shouting at me saying, I need to go. Riding in a barge to go to Antigua was the worst part of it. All of us packed on the barge out in the open was tough. Some of the residents had returned to Barbuda some days, some weeks after, while others, they took a longer time. Some they never returned. In Antigua, persons stayed at the shelters, at shelters. They stayed at relatives' home, they had friends, they had hotel accommodations. With total evacuation of persons living in Antigua, we wanted to know what was their experience like, because now this is where we're looking at the displacement now, and then there was separation, there was isolation. They had to leave their home that they know and then having to go and live with strangers. This is just pictures of what had happened, some of the destruction that was there. This was taken in 2018. However, when we went there, these pictures, the building are still standing as they are. There are no changes. So these are pictures that persons still see. They still wake up and they see these buildings every day. The stench of the island was terrible. The dead animals, the water, stained floors, the stench is something I will never forget. I worried when my daughter went to Antigua not knowing how she was doing. Living in someone else's home is not the same. Although I was welcome in their home, I was still uncomfortable. And all this was said from persons who had to leave their home and how they felt. After the devastation of Hurricane Irma, the resilient Barbudan population utilized a variety of coping strategies. These included praying, engaging in outdoor activities such as gardening, the use of alcohol and marijuana, and this was seen mostly with the young persons. When we interviewed them, they did say that they had used marijuana or they had increased their use in marijuana as a coping mechanism. Some relocated, some had connections with other persons, fostering relationships, and some provided support to other fellow community members. While we were there, we could have actually see the community spirit with everyone coming together as a community and just checking on each other. Lessons that were learned. Many Barbudans' experience of leaving their homes had been deeply traumatic, with feelings of powerlessness and inequity in compensation. It was crucial that they received the support they needed. However, they were not aware that psychological support was available from Red Cross. So Red Cross was one of the persons who were there on site. However, persons did admit that they did not know that they were there to give them psychological support. So they did not seek psychological support. Additionally, the forced relocation from Barbuda, especially under duress, where some persons would have talked about having to leave in the middle of the night, having a gun point in their face, persons being told that they have to leave their home, even though their home was not damaged. They see this as a hostile takeover, and this further exacerbated their distress. It is crucial to remember the following: an urgent need for individuals to be prepared for hurricanes. Now, as we said in the beginning, yes, they know the hurricane was coming. It was at a category 3, but then this category 3 changed right to a category 5 in no time. So even though you may think that a hurricane is coming or it's not, you still need to be prepared. The rapid intensification of the hurricane caught most people off guard again. Hurricanes causes widespread and devastating destruction. The need for functioning and adequate shelters is a priority. Although they did have shelters where persons were in the shelters and then the shelters were leaking, there were floodwaters in the shelters, they then had to be relocated to the hospital, and then that became overcrowded, which then the care which the nurses and doctors would have been able to provide it for persons there would have been diminished because of overcrowding. Training was not available to prepare individuals on how to deal with the hurricane, and many failed to take the warning signs seriously. The shelters in use were leaking, posing a serious risk of safety of those who were seeking refuge. As hurricane raged on, individuals had to be transported from the shelters to the hospital, adding to the chaos and the strain on resources. The hospital serving as a safe zone became overcrowded, making it difficult to provide adequate care. People turned to family, neighbors, and friends for shelter, and this highlighting the urgent need for safe accommodations. Throughout the hurricane, people experienced extreme fear and uncertainty, emphasizing the critical need for support and resources. Six years later, when we went to Barbuda, the aftermath of Hurricane Irma, you can still see the devastation. You can still hear it in the voices of the people when they relived and they talk about their story of what happened. One of our first encounters with a group of people, they were still upset because of what happened then to where they are now, thinking that enough wasn't done. And we coming there was just a way of us bringing back memories to them. So it was hard for them to even express how they were feeling. So some persons refused to even talk to us because of what they were going through and what they had experienced back then. Our primary goal is to understand the psychological impact of disaster on the people, particularly in Barbuda. That was our main goal why we went there. Despite the survival of Barbuda, the looming threat of future hurricanes exacerbated by climate change poses a significant risk. This only brings about physical destruction, but also takes a toll on the mental and emotional well-being of the residents. And this we did see coming out during our interview. When asked about their emotional well-being, this is what was said. The feeling I had lasted for a while, having my daughter evacuated, wondering if everything was good with her. I am good now, knowing it was only one life lost because I thought we would have had more lives lost. So it was a relief. Now I don't study it, it done gone. Who get help gets, it's over. Seeing life in a different way, making me harder, stronger physically and mentally. I don't think I can survive another hurricane. I am going north if another hurricane comes. I am not going anywhere. When I see the rain set up, I just start to get anxious. Barbuda can't survive another hurricane like Irma. Some of the things we're going to look at is to build resilience and self-sufficiency. Please ensure that you are prepared for emergencies by following these essential steps. Take part in educational programs and training for disaster. Preparedness with your community, preparedness for your community, preparedness in your home. This is essential. Understand the necessity of readiness and learn how to prepare effectively. Put together a grab-and-go bag with essential items like medication, important documents, water, food, batteries, a flashlight for at least 72 hours. And these are just some of the items. There are more items that can go in your grab-and-go bag, but these are just some of the items that we have listed that you can put in your bag. Develop and be familiar with an emergency evacuation plan. So just in case that you have to leave your home, know where you are going, know which roads you are going to take, how you're going to get there, who are the persons you are going to contact. Help to identify the individuals with medical conditions who may require assistance. And this is where community help comes in. It is crucial to establish a sustainable emergency shelters. The shelters them that were there, although they are shelters, persons would have went to these shelters expecting that they would be covered. However, these shelters was inadequate, causing person to have to leave these shelters and go into the hospital. Multiple emergency shelters are necessary to ensure adequate coverage. So we can't just have 1 and 2 shelters. We need more than that. So in case that something has happened to one of these shelters, there's a backup shelter. And these shelters have to be equipped with everything that is necessary during an emergency. Access to these shelters before and after disasters is paramount. Emergency supplies, food, water, and medication should be readily available in these shelters. The shelters should be designed to be climate smart, ensuring functionality during and after hurricanes. So this is very important because you cannot have a shelter and the shelter is not functioning. In conclusion, the resilience of the Barbudan population is genuinely inspiring. And a selective few are permitted to return in a few days, weeks, or months following Hurricane Irma. Even years later, the community spirit and togetherness remain evident, and this we saw while we were there. The Barbudan population continues to grapple with Hurricane Irma, lingering effect, which destroyed buildings and homes, serving as a stark reminder. So as I say, some of the buildings that were destroyed, they are still there, they are still standing. So every day they walk by the city's buildings, they are there as a reminder of the devastation that would have happened in 2017. The mere mention of Hurricane Irma still evokes unease of most. As we say, one of our first encounters was mentioning to persons that we are here talking about Hurricane Irma, and that just caused an unease to persons. And they did not want to speak about what was happening to them then and what is happening to them now. The aftermath of Hurricane Irma has left a lasting impact on the people of Barbuda. Some are still haunted by the dissatisfaction of their evacuation, while others live with the fear and anxiety of another hurricane destroying their homes and lives. It's time to acknowledge their feelings and provide the support that they need to move forward. So one of our hope is that after we have conducted this research, that we're able to provide them with some help, including psychological first aid, groups that they can contact. And we're hoping that not just for Barbuda, that we can take this further and go to other countries and continue this study for those persons who are affected by hurricanes in the past. And that brings me to the end. The increasing threat of climate change and its impact on health is a pressing issue. Extreme climate events can have a long-lasting effect on mental health. Hurricane Irma forced the residents of Barbuda to evacuate, and the physical and mental devastation still persists 6 years later. I would like to give a special thanks to Ms. Helen Boyd of the Canadian Association of Nurses for the Environment, who was the one who was inspirational in researching the psychological impact of Hurricane Irma on the people living in Barbuda. Thank you very much.
Thank you very much, Josephine. That was an excellent presentation on just the realities that we here in the Caribbean region face when it comes to extreme weather events and subsequent emotional disruptions and psychological disruptions. It's a very, very real thing for us. I know somebody mentioned 1988 Hurricane Gilbert in Jamaica. I was a kid when that was happening, and it was a very real event that I still remember. It's a very, very real thing, and the consequences are deeply felt. So thank you so very much to you, Josephine. Thank you so much, Peter, for your presentation as well. And as we pull you guys back up, I want to just ask one question of each of you, because we had so many questions coming in. And one of the questions that was posted was, what about the careers of health professionals who may be both responder and victim? How do we handle the psychological responses for health professionals who are also caught up in a severe impact of climate change concerns? Dr. Weller, would you like to take that? And then maybe Josephine can also give a take.
Sure. Can you hear me?
Yes, sir.
Yeah, that's a really important issue, a good question. You know, this whole issue of self-care is not about other people's self-care, it's about your self-care. And I think that we as healthcare providers, responders, need to learn how to take care of ourselves. It needs to be intentional. We're not just absorbing it by osmosis. We have to learn how to take care of ourselves, and each of us is different. So we each need different self-care strategies. However, the bigger question is, or requirement is, the organizational support for our wellness and well-being. Institutions need to understand the impact of not just climate change, but other stressors on us as providers, and set in place systems that will allow us to take care of ourselves. It's hard because resources are limited, but it's very important. I just want to make one other point. When it comes to natural disasters, one of the things we found in the work we did from Bahamas right down to Antigua, Barbuda, was that the people who were the most stressed and got the least help were the civil servants, the program managers, the responders, the people doing outreach. They were victims and they were responders, as the question asks. And we have to understand what that is. And it doesn't have to be a surprise. We need to preempt it. It needs to be part of our strategy. So that would be my response to that.
Thank you, Dr. Weller. Ms. Josephine, do you have a response for that one, or can I ask you another question? Once I get one more question.
Yeah, I can respond to that. As a health provider myself, we need to first recognize that we are going through this, because we need to recognize the symptoms in us and knowing how to connect it to know that this is happening because of this, and not just thinking, oh, it's just work, or we're just going through this. We need to recognize in ourselves that what we are going through, it's related to climate change, it's related to our mental health, it's related to the persons we're looking after, and then to bring it forward with our organizations, with our family, and find ways, healthy ways in dealing with this. Dr. Weller did mention that the impacts are not always negative. You do have positive impacts that come out from this. So we do build resilience from this, and then from that, we can end up building communities within our families, within our community, and within work with other workers that build that resilience, build that togetherness, and form an alliance where we can come together with plans on how we're going to mitigate these issues.
Absolutely. And I want to honor everybody's time. I know we're at time, but I am just going to ask one more question and then post some upcoming information. One more question that I want to ask you is, can we develop a pre-planned response to this type of mental health concern within our region, as it's so often neglected? You know, we wait until something happens and then we react. But do you think that there is a way that we can have a pre-planned type of action to mitigate these impacts that we're seeing in the region?
Josephine, you want to take that first?
I will go first. Yes, there is, but it has to start from all sectors. We have to involve government, we have to involve policymakers, we have to involve the communities, we have to involve religions. We have to have everybody involved, have a seat at the table where we can discuss, hey, we know these things are happening. Let us wake up. Let us put something in place, and not just putting it in place. We have to make sure that we enact these things and have persons be able to have access to whatever plans we have, so that by the time when these time come around, we're not just waiting until something happen. We already have a plan in place, and we already start putting these things down, and person are already acting on it. So that way we will have a safe network then that we can rely on.
I agree fully, and I would just say though that that is occurring in some countries. In Trinidad, you have a MHPSS, a mental health and psychosocial support technical working group that has representatives from many organizations, and I've seen it happen in other countries as well. I also see the collaboration between CDEMA, the regional disaster entity, and organizations like CANPA, the Caribbean Alliance of National Psychological Associations, and PAHO to create the space for this to happen. So I think the last comment I'd make is that it is happening already, it needs to happen more, and it is about who creates the space. There's a lot of politics involved and territoriality, and that gets in the way of our collective, our collective effort and efficacy. So we have spaces, we need to scale them up, and it needs support from all the entities, as Josephine so rightly said. Everybody has to be at the table.
Wonderful, wonderful. I just, had to do those 2 questions, that to at least get some questions in. So many questions came in. And I want to thank you both again for these powerful presentations. I want to thank everybody who has spent the evening with us. Thank you so much for allowing me to pinch over into your time, your morning, your evening, your night. Thank you. I just want to say, as you see this last slide here, the next session is Thursday, April 25th, 6 p.m. Eastern time. And we will be discussing with some more powerful presenters, health system resilience in a changing climate. So this will be another jam-packed session for you of presentation and case study to illustrate the reality of this. And it will be moderated by my dear colleague, Mr. Ansel Bonner. So looking forward to hearing from him on that one. I also want to remind you, please take your post-session survey. You can scan this barcode if this works better for you. The link has also been posted in the chat several times. So please make sure you scan. This is the way that you will be able to get your CME. Remember that credit you wanted for attending the session. So please do that. And you can also join the WhatsApp group. The link for that was also posted in our chat. And finally, I want to say a big, big thank you to our partners who help us to put this all together, to host and to design and to evaluate. So thank you so much to Columbia University's Global Consortium. And I had to write this out because it's a long name. So the Global Consortium on Climate and Health Education, otherwise known as GCCHE. Thank you very much for the time, the effort, the continued support for this. EarthMedic, EarthNurse, PAHO, Pan American Health Organization, thank you. University of the West Indies, thank you. And last but not least, our Caribbean Institute for Meteorology and Hydrology. Thank you so very much to all of you supporting our work and continuing to attend these sessions. Have a wonderful evening, and we will see you on Thursday again for our next session. Good night, everybody.
Night, take care.